Welcome to LabOPEX Live. And of course, this season is focused on careers. So come on in as usual and tell us who you are and tell us where you're coming in from. We're really excited about today's show. And before we start, I just want to let you know that one of the main reasons why we have focus on career for this season, I did a survey a couple months ago on the biggest career challenges facing medical lab professionals. And the top challenges were finding career options that are available. That was number one. And then there were knowing the role that's right for me and finding the role where I can make an impact. And because of that, we decided to make this season focus on careers because so many people are saying, I don't know of any career options, or I don't have enough options in the field of medical lab profession. And so we're bringing in amazing guests, people who are doing some awesome things in the field in unique career roles. And also, other than that, we're also getting ready to launch another cohort of aspiration medical lab professionals who are unsure of their next career options to identify their unique skill sets and operate at their highest levels. So we're getting ready to start a new cohort. We have a small number of seats. So to find out about the next cohort, just connect with me. Later on, I'll put a link in the chat. And so if you want to join that community of aspirational leaders who want to find out their next career options, then connect with me. And today we have another amazing guest. We have with us Dr. Andrea Pitkus. And Andrea is a lab informatics expert, and we're going to be talking about medical lab professionals in healthcare informatics role. So we promise that we're going to bring to you a lot of different careers in the medical lab field because a lot of people are saying we don't have enough career options. So come on in and tell us who you are, tell us where you're coming in from. And I'm going to, hi, Kristen, and hi, Anthony. I'm going to bring on our amazing guest today, Dr. Andrea Pitkus. Hey,
Hi.
Andrea, how are you?
Fine, thank you. Thank you for the opportunity to join your show today and interact with your guests and wherever they may be globally and talk a little bit more about informatics.
Awesome. So for people who are interested in health informatics or probably heard about it and is wondering what is this, today is your day. So come on in, and if you have friends or you know of others who may be interested, please share this out. Go ahead and start sharing this out. Go ahead and start liking it so that we can get that algorithm going so people can join the show, know that we're live. We have a lot to talk about today. There's a lot to learn from. So Dr. Pitkus, she is like, when I thought about informatics, I couldn't think of anybody else. But Dr. Pitkus, she has done so much in the field. So we're going to be at her feet today to learn from her. So we're going to jump in. And usually I start with asking my guests about how did they really start? And I want to ask Dr. Pitkus about her journey, like what it is, how did she start, what led you to become a medical lab scientist, and how did you get into lab informatics? Now you're a lab informatics expert. Tell us about that journey.
Sure, thank you. No, so I was in high school, of course, trying to figure out what to do in life and looking at different careers and things. And I discovered medical laboratory science. It seemed like a really nice fit of chemistry and biology And I didn't quite want to be a physician, didn't want to quite be a nurse. I thought you had to start with the bottom up, actually, from nursing. So I visited one of my local hospital labs, and after I had the tour, it really cemented my interest. Seeing the instrumentation and seeing cytology, we're diagnosing cancer. So I applied at universities and colleges that had medical laboratory science or medical technology as majors. Did some visits in my area and decided. And once I got to college, I really enjoyed the coursework and classes. And then I was in a 3+1 program. So I did clinicals my senior year. And there were several affiliate sites, but I ended up going to Duke University Medical Center, who had a clinical rotations at the time. They've now closed their program, so it's not there, but I was also able to do an alternate site at Mayo Clinic. And it's really cool because you get to see all kinds of different laboratory settings that you can practice in a lot of different things. But even the small college town we shadowed in the laboratory, there was a class that we'd go once a week, and it was a very small hospital, but I've also seen things there that I never saw anywhere else in my practice. So then I was getting ready to graduate, and I thought, I wanted to go work in different areas, but I actually joined Duke and worked in their main lab and had a lot of great experience and opportunities, more as a generalist. But they did have some other labs that were decentralized that I would, float up to or work at from time to time, and trying different shifts, that sort of thing. And while I was there, I noticed that I learned as much as I could about the laboratory information system. And I can say too, like in high school, I took programming class and a databases class and kind of dabbled into some things technology-wise. And some of those tools are really helpful in trying to solve some lab problems. Just, little ones at first, like, how do you do inventory of your stock of reagents and for ordering and things. And then, so I worked a lot with some of the folks that were working on those and, trying to show them how you can just set up a simple spreadsheet. And then they shared their knowledge from the laboratory information system, and we worked on interface checks. And we also did some things. I was made a super user on the job. So that was kind of more my laboratory experience. And I was working for a couple of years, and I decided, well, I really want to go back to graduate school. And it wasn't necessarily in informatics. I really didn't know about it at the time. I kind of stumbled into it in a way. I really thought I wanted to go develop new lab tests. I was doing some projects around the lab. And so I looked at master's programs in medical laboratory science. And there weren't really in North Carolina programs, but I did see, like back in the Midwest, University of Minnesota had a program. And so I was accepted there. And started working on my master's work. And lo and behold, there are these electives in health informatics as part of my master's degree. And the informatics program there was housed in laboratory medicine and pathology, which makes sense since we generate so much information in the laboratory. And so I took electives and just totally loved it. It really, I also had in the back of my mind, I didn't want to do computer programming. I wasn't like, it didn't really seemed like a fit for me, but informatics was because it was really working on the generation of information like we do in the laboratory. So that's kind of where I started. And then I actually was kind of finishing up my master's coursework, and they were looking for a teaching assistant for the health informatics program. So I had a discussion with some of the faculty, and I actually switched into the PhD program in health informatics, was a TA for a couple of years. And then there's this National Library of Medicine Fellowship for health professionals to work on their informatics training. And so I was fortunate to be at one of the training grant programs, and so was able to get on the NLM Fellowship for several years. I was really fortunate to have faculty that they had summer master's classes with their international partnership in health informatics education. So I was able to experience informatics globally. And then I also studied abroad in Germany for 6 months, which was really interesting to see, the similarities and differences in healthcare in another country and informatics as well. So really, there's a lot of different opportunities, and they just kept on building on themselves. And my dissertation topic focused on a laboratory problem, and I was fortunate to have an advisor who was a pathologist,
Wow.
that basically looked at diagnostic discordance with bone marrow specimens, because I was trying to figure out what type of problem in the laboratory would be good to solve for a dissertation topic, and thinking about how the three tests of hematopathology, cytogenetics, and flow cytometry, you can get different diagnoses potentially in the same specimen. Are they aligned? How does that impact clinical decision making? So I focused on that. But that was kind of more my educational path. And then I was getting ready to kind of finish my degree, and CAP was launching their Diagnostic Intelligence and Health IT department and team. So it was a great fit. Joined CAP, worked on the electronic cancer checklists, putting them into electronic format. And then a little while after I was at CAP, then Meaningful Use came out, which we know impacted a lot of the actual laboratory profession and healthcare, with all these physician offices now getting their EHRs and doing electronic ordering and resulting. And we actually were able to get a CDC ONC funded opportunity, the Lab Interoperability Cooperative, where we were working on with hospital laboratories tasked to teach them about electronic lab reporting to public health, or ELR, as part of Meaningful Use. So we traveled around the country. We aided over 1,200 hospital laboratories. It was a great team. It was a ton of fun, teaching them LOINC and SNOMED for encoding, putting them in touch with their public health jurisdictional representation. And we worked with about half the jurisdictions across the country. And it was great because we were teaching, but also learning much from the laboratory professionals who are the boots on the ground. What were the challenges they were facing with ELR? How about functionality with their different LIS and EHR vendors? What were the pressures that they were being asked to do by their management, that sort of thing. And so we were able to update our education, add in examples to help kind of further that education and help people along. And also with some of our reports to the federal government as we were working with them as well. So we worked there on that grant. And then shortly after that, CAP decided to exit the consulting business. And so I went down the street to a software terminology company as a product manager working on a laboratory product. And that was great too, because I really like working with laboratory professionals. One of the reasons I went into informatics is helping make lab life easier. So solving some of the challenges and problems we see in the laboratory with informatics as a tool. So I was working there on roles, and then I'm currently at the University of Wisconsin-Madison, and we're working on a clinical decision support tool for physicians, trying to reduce their time in the EHR, their clinical burden, and I integrate in laboratory results into their patient problem list. So I work using LOINC codes and laboratory data. So I continue to work on laboratory interoperability challenges and trying to break those down. So not only is laboratory data better utilized, but also able to help those downstream leverage and utilize laboratory data better.
Awesome. Wow.
I know it's a mouthful.
Yeah. And I just want, for our audience, if you're in and you're listening, let us know. Tell us who you are. Tell us where you're coming in from, because this is really interesting. For a lot of people, you hear about informatics and you're wondering what that is. And my next question is going to probably help to clarify some of those things. Like, people are like, is this really IT? You know, based on the post, is this IT? Is this just like data analysis? What does that do? I mean, I know Dr. Pitkus is saying solving problems in the lab. I mean, how does that happen? And I know you said a lot. Well, especially when you started out, you know, you started out by doing small things like helping with to solve problem with spreadsheets and, you know, inventory, just small things that you may not have had the education, but you had that interest, and you were showing that interest already even before you started any of the training. And the great thing about it, it seemed as if this was supposed to happen things seem to line up so well for you. You know, it's like you went to your master's, and before you know it, you're exposed to an elective that you found very intriguing, and then you decide you're going to continue with a PhD, and things just keep falling into place where Cap was working on a major project that you got involved in, and then we're talking about meaningful use, and a lot of people, maybe you need to expand on that. I know that that was something that the government gave a big grant to help with healthcare to put them online, but that's probably the most I know, and I didn't realize how involved the lab was in meaningful use, and you were part of the whole program helping to put a lot of labs. So can you talk a little bit more about that?
Sure. I know there's a lot of questions there. So meaningful use was basically about a decade ago an incentive program to get physicians and hospitals to adopt electronic health records, or EHRs, because some of them are still doing paper-based orders, and that's kind of not an efficient way to exchange data and for patient care. And so there was over 35 billion in incentives given out, so of money. But what's interesting, and I've been kind of working, I'm on a group called Shield that's working on some of the next, what's coming next for laboratories and lab interoperability strategy. And what's interesting is meaningful use was geared towards physicians and hospitals. So the only laboratories that are eligible to be part of those incentives were eligible hospital labs. And so most laboratories, including the largest CLIA segment of over 200,000 physician office labs, but it could be government labs, reference labs, weren't eligible to get any incentives and didn't really have incentive to adopt any of the standards for interoperability. So we saw some of that with the pandemic, with some of the breakdowns where information couldn't get from point A to point B, and the government was trying to get a handle of cases and everything. So it's really an important part of the needs. And I know you asked another question about what's the difference between health informatics and information technology.
Yes. So now, let us know what's the difference, because I know there's a lot of curiosity there. When people who are they're either in the lab trying to do something that's related to the lab, and they hear about informatics and they're like, should I do an IT degree, or how do I get into informatics? So help us differentiate IT and health informatics.
Right. It's a great question. And honestly, sometimes HR and others, kind of commingle the two too. IT is more a lot of what maybe your computer science majors are going to do. And, it's the hardware, it's the software, it might be doing installations and the support and around that. Informatics is really the study of the generation and use of information, which, if you really think about it, it's core of what we do in the laboratory, right? We have patient specimens, we're analyzing them, and we're generating a wealth of information and telling the physician, this is the status of the health of the patient at this particular time where the specimen was taken. Or, if there's something like cancer, we're diagnosing, prognosing, treating, giving them information for that. And what's really kind of cool about it is you don't really realize you're doing informatics as a laboratory professional. It's just kind of your innate training. And we're also kind of trained to be detail oriented and think about quality and quality improvement. So we're trying to improve things. So as we're generating this data, and of course the laboratory, we've heard the anecdotal quote that we generate 70% of the information in the laboratory that's in the EHR and utilized for clinical decision making from a Mayo study. And it's true, there's a lot of information that's really important, and it's leveraged by so many downstream end users. It's not just the physician providing care, although that's one of the most important roles and uses. But, we've seen the value of public health and public health informatics now with the pandemic for case, and even for physicians with case reporting, healthcare associated acquired infections in hospitals and other facilities. There's also a lot of research, clinical trials. I mean, everyone, we keep hearing about cancer moonshots, and, there's so much data that's involved with a lot of these trials for new drugs, even understanding the impacts of vaccines and other research. So there can be informatics within the laboratory, right? So we have our instrumentation, our middleware, we have our, quality control charts and our quality improvements in the laboratory, but there's also quite a bit downstream and outside the laboratory. And I'll say one key point about informatics, kind of informatics 101, it doesn't necessarily depend on technology. So you may hear informatics and think computers automatically. You can still have informatics based on your old paper report too. And it's some of the things are, the report's purpose is to communicate the health status of the patient and the results to the clinician. So as you're communicating, is your report format, is it easy to digest? Is it understandable? Do you need to have additional colors, graphs, or flags and our reference ranges? Are physicians and other end users understanding the data? You may do design of reports to make it more usable or more understandable.
Wow. So the usability has a lot to do with, so it's like the flow of information and what you can do to make sure things flow easily, any challenges to maybe pull out more from whatever data you have to make sure people can use it in the best way possible. So you're doing a lot of things with that to create information that's helpful to the end user.
Right. And if you think about too, like with our patients, we now have patient portals. We're getting lab data. So are your reports easily understandable by patients? There's a portion of some of the meaningful uses that patient education is a part of it. What's cool is if your lab data is link encoded, you can actually, there are websites you can go to like Medline and different things where you can actually, and I think Lab Tests Online have link codes too. So you can link that to your patient report to provide them layman's terms about their lab tests so they can understand, what was being done on their specimen.
Awesome. I'm going to say hello to some of our audience. They've been checking in. So I know I clicked on Gail Fontanaza. She is into some kind of IT. I think the last time she was talking, that was her next level career that she chose. I think a little bit after retire or close to retirement, she decided this is my love and I'm going to go into it. So I remember that she shared that on one of our live. There's a LinkedIn user, Emily Slaughter. Hi, Emily. Lance. Hi, Lance. I got to chat with Lance. Lance may still be in Minnesota right now. he was at one of the booths. So hi, Lance. Thanks for checking in. Lance, I'm back in Baltimore. I made it for the show. Vanessa from Maryland. Hi, Vanessa. And Meb, I know Meb is part of one of my coaching clients, and he is into informatics. He's actually just got his master's in informatics. Hi, Meb. And then there is Sophia from, okay. We may have connected there, Sophia. So we have a few more questions that we want to jump in to talk more about. I know we talk about the difference between health informatics and IT, but let's go more into the medical lab field. Like, how is this relevant? And I know you touch on that. What's the relevance right now to the medical lab field?
Right. So I mentioned that we generate so much information from the laboratory, and then communicating the information from the laboratory, making sure it's usable by the downstream end users. There's a lot of, I would say, challenges that have arisen. One of the reasons I went into informatics was to make lab life easier. There's all these different challenges that we might see. They might be little problems like how to be efficient or track things in the laboratory, outside the laboratory. Maybe you're on an interdisciplinary team working to solve a quality problem, perhaps trying to get more patients through radiology, but they have to stop and wait for a creatinine before they can do radiology images. And, getting a point of care test in that setting will allow them to see more patients and realize more revenue. So there's so many different ways that laboratory data can be utilized from an informatics perspective. And I mentioned public health informatics, but really we're well suited from the laboratory because we understand a lot what impacts the quality of lab data, the results. And one of the issues too is we've been on historically a paper-based communication mechanism in healthcare. And now that we have the computer systems that are adopted, it doesn't mean everything's perfect. There's still kind of this crawl, walk, run approach. And so when you think about physicians and those downstream, they want to leverage and utilize laboratory data. It could be analytics. It can be the reporting we talked about. But paper doesn't cut it anymore. So we've had historically some reports like microbiology and pathology and genomics now that have been like PDF text blob reports. Mm-hmm. That's fine if you're going to have a physician that's downstream reading it, but they're burdened with their time. So they're trying to make sure that there's more computer processing of data, including lab data. So the computer needs to be able to know what's the meaning of a lab test and a result. Mm-hmm. So it needs to be, first of all, electronic. Second of all, it needs to be discretely captured and then encoded. That's why we have things like LOINC codes for orders and results and SNMED for specimen information and qualitative result values. So the computer knows how to process the information and leverage that information. So you don't have a stop fail and work stops and you can't do patient care, or you can't get the information at your fingertips where it's needed most. And then it needs to be maintained and updated and messaged. If it's just historically like the LIS hasn't been very connected from the sense of exchanging with all the downstream end users like it does today, excuse me, you basically need to make sure that you can get the data outside of your LIS to where it's needed as well. The other thing I'll mention is you can't really tell the full meaning of a lab test by its name alone. Mm-hmm. And you need to know what specimen or the methodology. And while a lot of people don't realize that, or a lot of people don't aren't as familiar, especially for developers, about CLIA regs. So why do you need to have a reference range? Why do you need to have specimen information with your results? If it gets dropped, that's an important piece of data that's somebody missing downstream. Mm-hmm. So we don't want to have that. And if you're not provided encoding results, then someone downstream may try to map it to like LOINC. Well, they don't know the nuances of how the test was performed in your laboratory or your kit or your method. Mm-hmm. So they're probably going to map to a generic code, and you're already starting to lose information. Mm-hmm. Now, the question is, depending on the use, that could really negatively impact patient care and quality and safety. So there's a lot of things that kind of snowball, if you will. So we're well suited. We pay attention to the details and be able to provide quality information for those downstream consumers.
Awesome. So lab people know lab data, right? So it's best to have lab people working on things like those, right? So there's a lot of opportunity there, it seems. Sophia is saying that I wasn't able to make, okay. She said she wasn't able to make it to the conference, but I'm learning a lot from Dr. Pitkus as I'm a new graduate of health.
Yay!
Yay! At least 2 people I know so far that's on the, so you know what? Put it in the chat if you're in health informatics. Put that in the chat, or if you're interested in the field or you're already done training in the field, or you're looking for jobs in the field. Share that. All right. So so we're talking about that. How is the job market? Tell us, do you know how is the job market for lab people? Not just general people, but for lab people moving into health informatics.
Yeah, there's a need, even though people may not realize it. And it's going to be growing. It's going to continue to grow. As we're getting more and more electronic information, people want to leverage and do more clinical decision support, personalized medicine, you name the buzzwords. It's great. But the challenge is that everybody recognizes informatics and And there might be some people that might list requirements that are more the IT skills we were talking about. That might be computer science and programming, and maybe doing queries and reports and database work. So that might be one angle. And if you have skills in that area, it'd be a good mix. I can say that you don't necessarily have to, but if you wanted to, you could, take programming classes or database classes, those sort of things, as part of education. Also, there are a couple of different areas that are a natural progression for laboratory professionals. One is internally, like in a health system, as an LIS analyst or clinical informatics team. I know some people have mentioned, transitioning from one LIS vendor to another. That's a huge need, especially if it's within your facility or your health system where you know the tests, you know the names, you know the differences. You can help and be in those teams, but also support once you've made those transitions. You bring up a new test like COVID. How do you build that? How do you make sure it's encoded, ready to go? Working on interfaces, maybe you have new clients, outreach customers, and working with them. So there's a lot of different roles around that, typically within a health system. The other big area I would say that's been really growing is the diagnostic vendors, right? So I talked about using a spreadsheet way back when. I'm kind of showing my age and things, but a lot of your IVD vendors, they have middleware products. They have a suite of products in their portfolio and since they're really in the laboratory business, they leverage and really like laboratory professionals, because you're basically selling to your peers and helping your peers out in the laboratory. They do have products that look at inventory, and there's so many different areas. And then some of them are actually getting into the EHR side of the fence, as I like to call it, and working about, how do you help cut costs? How do you work on quality indicators? There's so many different areas. So you can kind of have your interest, whether you want to stay within the kind of laboratory environment, or do you want to go outside the laboratory where I am now. I've kind of been eking my way out and helping providers and others leverage lab data and understand lab data.
Awesome. So let's hear. Gail said, "Hi, Lona, glad to be here. Wanted to bring up to Dr. Pitkus how important informatics is in the role of validation consultant and copying data for legacy system to new LIS system that's being implemented." Is that what you're doing, Gail? Awesome. All right. And Sophia says she's looking for jobs. So they're like Dr. Pitkus is saying, so many times these jobs are disguised based on how they're presented. So I think that sometimes you probably need to either pick up the phone or send an email, or, try to figure out what, because they may be advertising something else. Is it usually because of the way the HR would word some of these roles?
Yeah, I mean, a good way is like thinking about, you can do informatics, interoperability, laboratory. A common term is informaticist, that's utilized in some of the roles. Sometimes looking like, if you're looking at more terminology and coding, that's an area I've been in. Maybe you search on Loink or SNOMED and some of the keywords, and then you can see what the position descriptions are. Sometimes it is an LIS analyst or clinical informatics analyst. So it really depends on both the setting. I mean, public health informatics is a huge area too, that there's really a lot of need. And sometimes it's working on reportable diseases. So looking on ELR, for example, for reporting from the laboratory to public health. So there's a lot of different areas. It's just, once you find it, you'll kind of get an idea once you're looking. I did a search online a little bit earlier for some of the key terms. And it depends too. Informatics is pretty broad, so you can focus in a lot of different areas depending on your interests. I mean, there's a lot of people working in pharma. I mentioned public health, and two, if you're working for companies leveraging lab data downstream from the laboratory, they might have other types of roles too. So I would say, it can be very fulfilling. One thing I'll say too is there is a clinical informatics or for board certification, but that's for physicians. So if you're a pathologist, that would be a good fit for you too. But if you're not, like I'm not a physician, I've just played one on TV, there are going to be different roles, and there's other certificates for training. You can do a lot of on-the-job training, kind of going into your analyst type positions, working with your LAS, but you can also pursue formal education. There's a number of certificates. AMIA, the American Medical Informatics Association, has a lot of certificate programs across the country. There's some online, but then there's also formal master's and PhD type education too, if folks are interested in those routes. I know it really depends on your where you are in life. If you can, stop and go back to school or go to school for additional education versus, having to continue to work and kind of get your education in addition to that.
Awesome. So Mav is saying, hello, everyone. This is inspiring as much as it's interesting, at least to me. He's into informatics. I haven't heard laboratory informatics before, but I always think of what can be used from the big data that we generate every day in the lab in this information era. Thank you, Dr. Andrea, for the great education information, and Miss Lona for the host. And that's so funny. A lot of times when we go study, and depending on where you go to study, if they don't know anything about the lab, you get so much general information. And it's until you either start using it or thinking about how the lab can fit. And I want for you, Dr. Pictus, to expound on that. But I had that experience when I did a healthcare MBA, because there's just so much on, focus on healthcare globally. But I thought that was advantageous because I could see how the lab could fit in the picture versus doing training on just lab and not making that connection. But sometimes if we don't, we can be like thinking that health informatics has nothing to do with the lab. So I'm glad that we're having this discussion. So what's your thoughts on that?
No, I think cross collaboration and communication amongst fellow healthcare professionals, or even just too in the business line, because one of the things too, especially if you get into industry, is usually there's products and services with a business goal in mind. And so having to talk with your salespeople or talking with product managers or others and customers, and also when you're working with a lot of customers, depending on their different roles, they may have different understandings of the laboratory and laboratory data. And I want to use an analogy. I call it the burger analogy that I came up with when I was trying to explain some laboratory principles, if you will, and aspects to some members of a team I worked with. And it continues to resonate with a lot of people. I liken laboratory test menus to a fast food menu. Everyone thinks whatever a physician wants to order, they get. If you want to go into, let's say, a taco joint and you try to order a burger, no matter how much you want to order that burger, you may not be able to get it because A, it's not on the menu, they don't have the supplies, it's not set up, etc. So they have to go elsewhere. So it's really important when you're setting up interfaces to an EHR that the contracted laboratory offers the tests the physician wants. The other thing is the physicians tend to think about things sometimes in a more general terms, like I want a burger. But the reality is one laboratory might have a Big Mac and another one might have a Whopper. And we know that there's distinctions both competitively amongst laboratories, but just even how they perform some of the same types of burger tests. And the EHR, often it's this generic term because that's what, physician preferred term is. And that's fine. It's not a problem. But back in the back end, behind the scenes, they have it mapped to the number 1 value meal or the number 2 value meal, maybe with fries with that. And so that might be the test order number 1 on your menu and test number 3 on the other menu. And that's how the ordering process and resulting process kind of goes from a loop-to-loop, end-to-end workflow. And the challenge, too, is the performing labs naming conventions may never even be reflected in the EHR. Physician may never see that. So you start exchanging this data. How does a downstream physician, say a specialist ordered something and it's, coming back to the generalist or the primary care provider, how do they know it's the same test from your performing laboratory if the naming conventions are changing? And it's something that I kind of discovered in some of my work over the years. And it's a little frustrating for me because it's like we're trying to solve this interoperability and make sure that information is understood. But then there's some things related to kind of some of the EHR builds and functionality that I don't say shoot us in the foot, but sometimes contribute to that interoperability and the variety of lab naming conventions. So there's a lot of these issues that still need to be solved, and we need people that can speak to them, educate, communicate with those outside the laboratory about laboratory needs, and for patient safety and use of the data.
Awesome. Wow, you're making such a great connection. Um, Many years ago, when I went to grad school and started doing healthcare quality, I kind of stumbled on healthcare informatics. I don't know if that might be am I echoing somehow? And I started kind of going down that route. And but then, now, it's like I can't be doing everything. But now I'm seeing that it's so relevant to patient safety and quality. Health informatics, you're helping me to understand how all the connection, how broad it is, and how valuable it is. And it's not just this IT thing. It's so very relevant to almost everything that we do, because if we don't have people in health informatics helping to solve these issues and flow, and you talk about interoperability, maybe you could expand on that. I suspect I know what you're talking about. And you talk about Loink also, that maybe you could expand on that. But before you talk about that, let's hear what Karen is saying. Lab professionals are subject matter experts on lab data, and there needs to be increased collaboration with lab and IT departments. Awesome.
Emphasize collaboration.
Yeah, I just saw, I just saw that collab thing with, is that ASCP, I think, collaborate, I think. Yes. So tell us a little bit more. Let me mute and see if it's. So tell us a little bit more about interoperability and
Sure.
Explain Loink.
Sure.
Loink.
Loink is basically the coding system that distinguishes different lab tests by specimen, method, etc. And it's the required standard terminology nationally, but also by many countries globally. It provides meaning to the lab test. So let's just say you have a CBC, one has a platelet count and one does not, but they're both named CBC. How is the physician going to know they're two different panels? There'll be two different Loink codes. And really, it provides that computer the information so it knows when the technical teams are working on queries and things and reports, so they make sure that they get what they want and analytics and etc. The other question you had on interoperability. Interoperability is pretty much the exchange of data from point A to point B. So we think about laboratory interoperability. Are we getting orders from EHRs into the LIS and results back and messages to public health, etc.? Semantic, and so that's usually called syntactic interoperability. It's, do you have the connection, the information flow? Semantic interoperability takes it up a notch and really, does the computer know the meaning? Do you know the distinct meaning of what you're communicating from point A to point B? So that's where we start getting, think about for public health, they're getting all these like results from all these different labs. How do they know that lab A and lab B and lab C are actually using the same methods without having, Loink encoded results for their computer systems to process versus having to stop and manually look through and do analysis? And I'll mention another thing that we saw with the pandemic is the shift to more consumer-based testing. And that's an area that's going to grow too. And people are going to need help, especially if they don't know about CLIA or getting the data. And the informatics challenge right now is when you're doing, like, say, your consumer-based COVID testing, how do you get that into your EHR? Your phone isn't connected to the EHR or your app or whatever you're using to record your results. Right now, the best way is just to message it to your provider, but hopefully we'll have a solution in the future where you can get that into the provider. And then they'll be required by public health laws to report to public health and then on to HHS. So that's going to be a challenge, and that area is going to grow. It's not going to be just COVID. There's like home dipstick results. You can go into your favorite drugstore and get STD testing in addition to like the genomics testing. So that's an area that's going to grow too.
Awesome. Awesome. This was really, mute one sec for me and let me see if it, the sound coming from both. It's echoing. Um, Thanks so much. I'm going to let you on mute, but this was great. This was a lot of great information. It clarified a lot for me, and I hope it did for the audience. I know for some of the audience, they're already into health informatics, but I'm sure that you gave them a lot to think about in terms of jobs that are available, some of the things that they can do in terms of job search, and especially what you did when you started out, some of the things that you took, you were very proactive in helping in different areas. And I can just see right now there's so many areas that people can help with when they're just general LIS. There's the you have interfaces that they can help to work on. You have things like you have the WAM and the DI and the other things that they can help with in the lab, just starting out, just getting their feet or their hands wet. So there's just a lot that we can do. We learned so much from you. Thank you so much. Any last words? And I'm going to also ask you to share how the audience can connect with you and learn more from you.
Sure. Great points. I would say there's opportunities are endless. I'm not going to say that there's timing is key for jobs too. So keep looking if the right description isn't out there. And because I know that's impacted me too in different transitions. I'm on LinkedIn, so feel free to connect with me. We can have conversation or, beyond this as well. The other thing too I'll mention is, some people might want to do consulting. Some people start up consulting business, or even retirees if they want to kind of keep their feet wet, as you were indicated. You can do as much or as little as you want. But thank you to you and your audience for hosting. I mean, it's a great topic, and I'm look forward to chatting more. And best wishes with everyone in their informatics journeys.
Thank you. And we're going to hear some last words from the audience. This was so insightful. I always say my LIS team works magic. There's so much going on behind the scenes. And Angela is saying great discussion of the importance of IT and LIS for lab IT specialists overall with lab background, or when dedicated to lab, is extremely effective and useful. And Sophia is saying, thank you, Dr. Pitkus and Lona. This was very informative. And Lance is saying, LIS is the glue that keeps the lab functioning at high levels. And Gail is saying, thanks so much for presenting. Thank you so much, beautiful audience, for always being awesome, always engaging, always asking questions, always interacting. Thank you so much. I know you learned a lot today. I learned a lot. Thanks so much, Dr. Pitkus. This was awesome. And audience, please share this out. I know there's a lot of people who would benefit from this, so go ahead right now before you forget and start sharing. And have an awesome evening, and see you next Thursday, where we have another amazing person from the lab that's doing amazing things. Have a great evening.